Jen Jiva recently graduated from an accredited dental hygiene program. After receiving her license, she has been working as a registered dental hygienist for Dr. Mel Practice for 3 months now. She really loves the office and the patients.
Good morning, doctor. I was just looking over some patient charts to prepare for the day. I'll be seeing Miss Smith this morning. She's on the schedule for a prophy, but it looks like she had some deep probe readings last year, and there's quite a bit of bone loss on her x-rays.
Oh right, she did have some signs of attachment loss when she first started coming here. You can spot probe a few areas if you're worried about these pockets, but I think you'll find her mouth to be pretty straightforward. Remember, things are a lot different here than they are in dental hygiene school.
Later that morning, Jen sits down for her appointment with Miss Smith.
Good morning, Miss Smith. My name is Jen, and
You new here? You're not going to give me any lecture about my teeth or try to make me come in all the time, are you? I left my last dentist because he was always trying to force me into these expensive dental procedures and make me keep coming in every couple of months. I think he wanted to buy a new car. I can barely pay the bills that I have, and I can't afford to take a bunch of days off from work just to have you guys look at my teeth.
well, we certainly don't want you to miss work or feel forced into any unnecessary treatments. But before we get ahead of ourselves, I'd still like to start with a few assessments to check the overall health of your mouth.
Jen completes a full mouth periodontal exam on Miss Smith and finds that Miss Smith shows signs of active periodontal disease, including heavy gingival bleeding and 6 to 9 millimeter pockets. After completing her assessments, she excuses herself to present her findings to the dentist.
Doctor, I just completed my assessments on Miss Smith, and I think you should have a look. Many of her 7 millimeter pockets have increased to 9 millimeters since last year, and her gingiva are really inflamed. I think she would really benefit from a full mouth scaling and root planing.
Jen, it's great that you want to show initiative, but you've only just started here and you don't know the patients yet. The treatment you're proposing would cost between $1,200 to $1,500. If we were to tell Miss Smith that she has periodontal disease and suggest a full mouth scaling and root planing, I guarantee she'd accuse us of trying to rob her and leave our practice. A prophy will be enough to help her for now. Then maybe after she's come to trust our office, we can suggest something a bit more involved.
What should I do? If I just do the prophy, then that will satisfy Doctor and Miss Smith. But Miss Smith won't be getting the treatment she needs. Isn't that supervised neglect? If I don't do what the doctor tells me, then she might not trust me anymore. I really like it here. I don't want to lose my job or cause any conflicts in this office. But if Miss Smith's periodontal disease is getting worse and we don't tell her, then she could sue us. You're right, Doctor. Miss Smith will probably refuse a full mouth scaling and root planing, but I would still like to make her aware of my assessment findings and her treatment options. It's her right to refuse any treatment we recommend, but she can't give informed consent or informed refusal if she's not informed. I'm also worried that without full disclosure, she could potentially sue the office for negligence.
So Jen sat down with Miss Smith and presented her assessment findings, what they suggested, and Miss Smith's treatment options.
Now I know that you don't want to be lectured, but it's my responsibility to inform you of my findings.
Oh no, not this again.
Ultimately, Miss Smith refused the scaling and root planing and would not increase the frequency of her recall visits. But Jen felt better knowing that she had informed her patient and protected herself and the office by properly documenting Miss Smith's informed refusal.